Okay, go to the first slide. So, okay, thank you very much for inviting me to give a lecture on the understanding MOH Medical Act and medical legal related issues on aesthetic medical practice. Thank you for your kind introduction. So I have 2 hours for this lecture. So hopefully I can deliver the best information possible to all of you. Most of you probably already have a clinic or may have some intention to open a clinic with aesthetic practices in the future. Okay, let us begin our lecture today on the MOH Medical Act. Next slide, please. Okay, there are a few topics that I'm going to cover today. Number one, I'm going to explain the definition of Act, guidelines, circular, directive, and code of conduct. And then what are the implications if all of us fail to adhere to any of the document above. The third one will be the overview and difference between MMC guidelines on the aesthetics practice and aesthetic medical practice guideline. There are two different guidelines that we have to understand and follow. First one is from MMC, and second one is from the medical practice division. And then I'll touch a bit on the Akta 586. I think all of you know about this act where if you want to register any clinics, all the registration processes will be follow the Akta 586. And then what are the view of Akta 586 in medical practice, in aesthetic medical practice. And then some example, number 6 too, I skip first. Probably we go and discuss after if we have extra time. And then certain things that probably will be overlapping. So here I add how to open a clinic later on. Yeah. So I will explain how if you want to register a clinic under your own names and how about the process and all that will be covered under this lecture. Okay, next slide, please. This is a common question being asked by all doctors, especially the private doctors in Malaysia. Why MOH is so busy regulating us? Yeah? And then now, why is MOH regulating aesthetic in Malaysia? So number one, that we want to ensure the safety of aesthetic medical practice in Malaysia. So as you all know that nowadays there are so many doctors doing aesthetic practices in Malaysia. Some of them are well trained, some of them half trained, even some of them are not trained at all. As you all know that in our mainstream newspaper recently we have cases being get treatment, aesthetic treatment with fillers and all that not in a clinic but in the hotel, in certain house, apartment and all that, and then end up with a very bad complication. Even some of them already died because of the allergic reactions. But all these actually not done by doctors probably, or by bogus doctor, or by unregistered person or non-trained person. Yeah, but most of them actually are beauticians. They try to give aesthetic medicine by learning from YouTube. That is the most dangerous thing. That's why MOH need to regulate this to make sure that all our patients, all our people in Malaysia are safe to receive any aesthetic medical practice. Number 2 is to uphold the professional standard of doctors practicing aesthetic medical practice in Malaysia. As a regulatory body, we have to make certain standards to make sure that all these practitioners must go through certain training with certain qualifications. Because in Malaysia, aesthetic medical practice is not yet considered as not considered as a specialty or subspecialty yet. But however, we need to regulate these doctors, the practitioner, to make sure that the professional standard of doctors adhere to. Next slide, please. Okay, I think many of us actually have always, if you go through a newspaper, you know what is acts, yeah? In bahasa we call this akta. What is circular or perkeliling, yeah? Akta is a body of rules of action or conduct prescribed by controlling authority and having binding legal force, that which must be obeyed and followed by citizens, subject to sanctions or legal consequence is a law. Yeah, this is what we call act. Yeah, we have a lot of acts in Malaysia. For doctors, you must register yourself. It's under Act 50, yeah, Acta Medical Act 1971, which is amended in 2012. So this is what we call act. Yeah. So if you fail to follow or adhere to the act, probably some legal action will be taken against you. Yeah. For example, Acta 586, you need to register your clinic. Yeah. So when you have a certificate of registration, means that you can practice legally in your clinic. And at the same time, you must have your APC, Annual Practice Certificate, under Acta 50, Act 50, which is the Medical Act 1971, which allow you to practice for that particular years. So these are all acts, yeah. So if you fail to follow this, you can be taken whatever actions, legal actions against you. For example, for doctors, fail to produce a valid APC for the year, probably you can be taken to the preliminary investigations committee of MMC, and certain action can be taken against you. For example, maybe you can be remanded, or you can be strike off events. Yeah. So be careful about the acts, and then you must understand the consequences of the if you fail to adhere to the acts. Second one is the circular. Circular means kalau bahasa Malaysia kita kata sebagai perkeliling. Circular is a document circulated by the government's department on behalf of minister, setting out policies, principles, and practices for the exercise of ministerial powers delegated to public officials. In most cases, circular provide mere administrative guidelines and have no legal effect. But for the government servants, yeah, you have to adhere to the circular. For example, kita ada perkeliling tata tertib for the tata tertib actions 1993, which is very very old circular, but still in place and still actively taking any disciplinary actions against our staff. I mean the government staff. Next slide, please. Directive, something that serve to direct, guides, and usually impel towards an action. It is the authoritative order, directive, or instrument issued by high-level body or officials. Some may be legally binding. Example, DG's directives under Section 76 Acta 586. Code of conduct is something different. It is a guideline for a minimum standard of appropriate behavior in a professional context. Codes of conduct draws on ethical principles, sit along the general law of the land and the personal values of member of professions. Yeah. See, most of the code of conduct is under MMC, under the Medical Act 1971. However, it is not the sometimes it is not related to the not hooked to any acta, but it is minimum guideline for us to follow. So that's why in terms of aesthetic practices, there will be a specific code of conduct, for doctors who practicing aesthetics in Malaysia. Next slide, please. What are those implications on non-compliance to the documents? If it is acts or legally binding directive, action may be taken toward the offender, depending on the offence stated in the act and or directive. It can be compounded, charged in court of law. For example, it can be fines or jail, or others as stipulated in the act. Circular actions for non-compliant is often stated in circular, commonly administrative in nature. CPC or Code of Professional Conduct, violation of CPC may result in disciplinary actions by the councils. We as a doctor, from the action will be taken by MMC, but for those LCP holder, So the LCP committee has the power and right to take an action against you. For example, they can just uphold your LCP certificates or letter of credentialing and privileging, or they may strike your name from the registrations book. Yeah, so it means that you cannot practice any aesthetics practices anymore in Malaysia or at your clinic, yeah, once your name being struck off from the register. Okay, next. Okay, as I mentioned earlier, we have two guidelines mainly to govern aesthetic practices in Malaysia. The first one is from the Malaysian Medical Council, and second one is from the Medical Practice Division and Mohd. So under this guideline issued by MMC, the guidelines on ethical aspect of this is guideline of the ethical aspect of aesthetic medical practice. Yeah, it is issued by Malaysian Medical Council in 2015, and then you can exit this guideline is easily available at the MMC website. So in this guideline, it delineates the general ethical guideline for the practitioner under the Medical Act 1971 jurisdictions. Yeah? But this guideline is very thin guideline, 7 pages guideline, which is very specific for the aesthetic medical practice in Malaysia. Next. Okay, I just highlight a few important point under these MMC guidelines on aesthetic medicine. Next. Okay, this is very important. You must understand and try to memorize this. This will be important question and point that you have to remember and understand. And what actually definition for aesthetic medical practice? This is based on Malaysian's definitions. Yeah, it is an area of medical practice which embraces multidisciplinary modalities dedicated to create a harmonious physical and psychological balance through a non-invasive and minimally invasive treatment modalities, which is evidence-based. These modalities focus on the anatomy and physiology of the skins and physical appearance to satisfy the normal, non-pathological, remember that, non-pathological aesthetic desires and goals of the clients and are carried out by registered medical practitioner. This is only we can call aesthetic medical practice. You know that out there, a lot of spa, a lot of beauty center, beauty parlors, they claim that they are also providing aesthetic medical practice. They are not, because simply they are not registered medical practitioner. They are not doctors. Okay, some claims they have a doctor's title, yes, but they are PhD doctor title. They are not a registered medical practitioner. Be careful. If you come across any of the center, spas or beauty parlor, and the beautician claim that he or she is an aesthetic medical practitioner, please lodge a report to us. So we will take actions against them because they are not a registered medical practitioner. For those who want to practice aesthetic medical practice, they must be a registered medical practitioner having valid APC for that year. Okay, next. This is some information that maybe not nice to listen to this, but so we must realize that MMC not recognize aesthetic medicine as a medical specialty in Malaysia for the time being. So for those are having extra or second degree or even PhD in medical aesthetic, still cannot register under the National Specialist Register or NSR. For your information, MMC is the custodian of NSR with effects of Amendment of Medical Act 1971 and Medical Regulation 2017. Okay. Under the medical practice divisions, aesthetic medical practice has not been recognized as well as a medical specialty in Malaysia. But the medical practice division of Ministry of Health maintain the National Registry of Registered Medical Practitioner practicing aesthetic medical practice. Yeah. Who actually, whose name actually being registered under the registry? Those are having LCP. Those who has passed their LCP. Yeah. It means that after you taking your exam, you get through your exam, your theory and your viva as well. So your name, you get your LCP. So once you got your LCP, your name will be written under this registry. Yeah, so we'll register you in this registry, and medical practice division will keep this registry, and we will publish your names in the MOH websites under the SLP folder. Depends on your chapters. Okay, but mind you, this is not a specialist registry. Next. As per MMC guidelines that I've shown you just now, scope of practice not mentioned. Scope of practice is not mentioned in another MMC guideline, but under the MOH guidelines, the scope of practice is categorized as Chapter 1 for GPs, for general practitioner, Chapter 2, LCP Chapter 2 for medical specialists, and LCP Chapter 3 for the surgical specialists, yeah, ENT, plastic surgeons, or whatever. Yeah, as long as they have their second degree, yeah, specialist degree or master in surgical base, they can have LCP Chapter 3. Okay, next. Okay, role of MMC in aesthetic medicine practice. Under the section 3G of the MMC guideline on the aesthetic medicine, the registered medical practitioner in aesthetic medicine practice is subject to all relevant parts of the amended Medical Act 2012 and the regulations when adopted, and is subjected to the Code of Professional Conduct, Good Medical Practice, and confidentiality and any other guidelines of the Malaysian Medical Councils. It means that once you are registered, you are registered medical practitioner in aesthetic medical practice, you are subjected to all sections, all regulations and CPC under the MMC jurisdictions. So we can't run away from this. Okay, this is why we do this, because as the first slide that's mentioned just now, we want to make sure that the safety of our clients, and we want to uphold the standards of our aesthetic practice in Malaysia. Okay, next. Under the section 9 of the MMC guidelines, which is very good sections of this. I think most of you like these sections. Yeah. In this section, they have clearly mentioned about the assistance. Yeah? The registered medical practitioner in private aesthetic medicines practice may employ non-medical, unregistered persons like beautician, cosmetic therapist, and other to assist in his practice, who will be termed as assistant for purposes of this guideline, but should not be associated with such person as business or professional partners or as an employee. It means that you may employ any non-medical unregistered person or beautician, anyone, to assist you in your practice, but should not be associated with your business entity. However, the registered medical practitioner shall be vicariously and totally liable for all untoward professional occurrences or adverse events that may become the subject of a complaint or subsequent disciplinary inquiry in relation to such assistant under his employment. It means that your accountability, your responsibility on your assistant. It means that if you employ non-medical unregistered persons to assist you, the responsibility, the accountability of the untoward professional occurrences or whatever side effects or adverse events happen to your patients is still on your shoulder. You must take the responsibility of this. So it means that all actions be taken against the RMP under the MMC guidelines, under the MMC Act, under the Medical Act 1971. Yeah, it's not against So the action cannot be taken against the assistant. That's why if you want to employ any non-medical or unregistered person, you must make sure that that person is only to assist you, not to do the procedure for you. Yeah. So make sure that this is very clear guidelines, and there's very clear sections about the assistant in the MMC guidelines. Okay, next. Okay, this is the limitation of this guideline. Under the MMC, all acts, other acts or any amendment to any existing act when becoming into force may eventually address some aspect of aesthetic medical practice and other related treatment modalities, in which case this aesthetic in which case these ethic guidelines may be appropriately amended by the Malaysian Medical Council as or when required. So so far these guidelines has not been amended by the MMC for the ANI, but the MOH guidelines we have produced a second edition of it. Yeah? All practitioners of aesthetic medicines need to be continuously aware of any law, regulations, or guidelines that are gazetted or approved for use by MOH or MMC. Ignorance of the law is not a defense. You just cannot say, oh, I do not know this, I do not know that, I do not know this is the new regulations. So you have to be aware, because most of the changes or amendment of the law, regulations, or even our guidelines, so will be published in our websites. So you need to go to our websites quite regular, yeah, to make sure that all the guidelines, clinical, even the code of professional conduct, being updated once. So you have to aware of this. Yeah? Ignorance is not a defense. Okay. Next. There are two guidelines that I've mentioned just now. Number one is by MMC, which is the guideline on the ethical aspect. You can easily download from MMC websites. Though the second one is from MOH, the guidelines of aesthetic medical practice for registered medical practitioner. Next slide, please. Okay, now a bit on the guidelines on the aesthetic medical practice, which is I think this is the second versions. Yeah. Okay, next. Okay. Okay, the new one, the second edition of this guideline, which is pink in color. The first edition was blue in color. Okay, now we follow this, the second guideline. Okay, under this guideline, yeah, I think all of you have seen this guideline. Later on, you can even download the soft copy of this guideline from MOH website. Under the Medical Practice Division website, you can download it free of charge. Okay, so under this aesthetic medical practice guideline for registered medical practitioner, here clearly mentioned on the chapters what are the procedure allowed under each chapters. Yeah, what are the minimum qualification for you to be registered under the registry for aesthetic practitioner in Malaysia, and if you don't get through your LCP, how are you going to appeal for the LCP? And then even in this guideline clearly mentioned the minimum requirement for certain certain procedure for you to get through before you can grant LCP by the Ministry of Health. Yeah. Okay, next, please. So under this second edition, which is as I mentioned earlier, all the requirements to get LCP being listed out in these guidelines. The most important things that in this guideline has mentioned about the 3 chapters for the LCP holder. Yeah, as I mentioned earlier, chapter 1 for the general practitioner, chapter 2 for medical specialists, for example, dermatologists, yeah, physicians, and the third one, the third chapter for surgical specialists, ENT specialists, plastic surgeons. Most of them are actually belong to these two groups. Because ENT surgeon, they want to do some DNS or mancungkan hidung and all that. And then for the plastic surgeon, there'll be a certain procedure. For example, maybe macam apa ni, hair transplant and all that. The list of the procedure under these guidelines to be defined into 3 different groups, which is non-invasive. For example, some skin abrasions, for the peel, chemical peeling and all that. Minimal invasive means that we penetrate the skins, whatever procedure that you use penetrate up to the subcutaneous tissue. And invasive, most of the times, some invasive procedure we prefer to do it in hospital rather than in GPs or in ACC, because certain procedure, invasive procedure, may need general anesthesia. So the follow-up and the follow-through treatment of the invasive procedure will be a bit complex. Okay, next. Okay, now we go to the Private Healthcare and Facilities Service Act 1998, which is Akta 586. So actually this act, which is not to, some say this act is very tough and then always want to punish people. No. This act is not to punish people, but this act actually to control the registration and licensing. Registrations mean what? For the clinics, For clinics, GP's clinic and specialist clinic, we register them. It means that once you get registered, you don't need to renew your registrations, So once you got your registration, this for life actually. But for the licensing, example, hospital, ACC, hemodialysis center, this is the licensed facilities. So license means we have to renew the license every 2 years. Okay, there is a difference between registrations and licensing. And then second part of the law actually to regulate and then certain, of course, when there is non-adherence or non-compliance to the acts and its regulations, of course, certain enforcement will be taken against you. So far, numbers of enforcement has been taken. Even some clinics, we shut down the clinics, we terminate or we cancel the registrations because of the some activities, especially the maternity clinics, because a lot of issues in terms of ethical issues, safety issues, and then non-trained doctors, and then fail to follow certain SOP in managing a patient. So this type of clinic actually we revoke the license and we terminate the services in that particular clinic. Okay, next. Okay, objective of Akta 586 is number 1 to address social and to address social and national interest, to make sure that everyone is safe, impose and ensure minimum standard in private and healthcare facilities, which is, I just want to highlight here, Akta 586 is to ensure minimum standard. You can go beyond this, whatever written in Akta 586 is a minimum standard in private healthcare facilities in Malaysia. Number 3, to ensure professionalism among healthcare professionals. Number 4, to ensure integrity among healthcare professionals. Ensure quality of healthcare facilities and services. For example, under the Act, we have sections and provisions of law to see the quality assurance, the mortality review, as well as to manage the aduan if complaints against the facilities. But the main focus of this Akta is to safeguard patients' interest and ensure patients receive safe treatment from any doctors. Okay, next. Okay, this is quite busy slide. If you see here, under the Akta 586, an act to provide for regulations and control of private healthcare facilities and services and other healthcare related facilities and services from matter of related year to. Okay, for your information, this Akta, though it is gazetted in 1998, but only come into force 1st May 2006, but 8 years after that. Why? Because of, number one, we need to prepare the regulations. Any Akta, any act without regulation, actually we cannot put into force. So under this Act 586, there will be 19 parts and 122 sections. You can see here the most important part is, I just want to highlight one of the parts lah. Okay, for example, for the license, part 4 and part 5, COR. COR means certificate of registrations. Okay, that will be under section 25 to 30 of the Akta 586. Here, any clinics, for example, your clinic later on, GP's clinic, or any other or dental clinic, all the registrations is under part 5 of Akta 586. Under the part 6, what are the responsibilities of the doctors? What are the responsibility of the PIC, of the registered medical clinic? So all this being stipulated clearly under the Akta 586. So that's why any contravenes or any non-compliance to Akta 586 actions can be taken against you. So but we in Bagian Amalan, before we take any actions, we advise first, we facilitate first to the PIC to make sure that we all follow all the requirement of any sections in law, as well as in act, as well as in the regulations. Okay, next. Okay, this is the regulations, private healthcare facilities and services, regulations 2006. Just now was the Akta per se, the Akta Ibu, the primary act. This is the regulations. Okay, under these regulations, we have different regulations. This is that I'm going to show here is a private medical clinics and private dental clinics regulations. It has 14 parts, 109 regulations, and 7 schedules. So we have a different regulations. We have the regulations for GPs, I mean for the medical and dental clinics. We have regulations for hospital. We have regulations for hemodialysis center, as well as the SCC maternity home and all that. So there'll be a different regulation for different type of healthcare facilities and services. Okay, next. Okay, this is the one that for the private hospital, we have a 29 parts, 434 regulations, and 13 schedules. So one of the most important schedules under this act will be the fee schedules, Schedule 13, which control the charges for the charges for any procedure by our colleagues in private hospital. This is how we control the fee for the doctors. But now the jadual ke-13 is under amendment, so we are doing some amendment to it, because all the charges actually, which is the last amendment was 10 years ago. So actually the charges we need to review nowadays because of the increment in the equipments, increment in the consumables and all that. So that's why we need to review the charges. So we will increase the charges accordingly. All right, next. Okay, under the aesthetic medical services at private healthcare facilities can be provided in where? In your clinics, in GP clinics, or some specialist clinic. For example, medical specialist clinic, they can provide the second chapter's procedure under your clinic. You can do the second chapter's procedure at your clinic. So second place for you to practice aesthetic services is in ambulatory care center, ACC. And the third one is private hospital. That's why I said just now, we have a lot of bogus doctor, bogus practitioner. They do all the procedure not in these three places. They do certain fillers activity, even some operations, yeah, halal-plasty and all that in hotel, in apartment, which is not a proper clinic, which is not a proper place to practice invasive or to do some invasive procedure. Yeah. So how you can apply for these services? Number one, of course, for you to practice, you must have a place of practice. For you to practice this, if you want to apply for the clinic, yeah, you have to submit borang through MedPC. I will explain later. Yeah. For the ACC and hospital, you can follow the pre-establishment hospital requirement and approval, as well as the licensing procedure under the Akta 586. Yeah. Okay, next. Okay, now I'm going to touch on the a bit on the letter of credentialings and privileging, which is very, very important for you all. You must have all these, must have this LCP before you can practice aesthetic in Malaysia. Yeah, it's a field of interest. Next. Okay, this is the example of LCP. Yeah, here you can see under the chapter 1. So we have already specified in that LCP what are the procedure that you can practice under your chapters. Yeah? For example, here for this doctor, we have grant him chapter 1 LCP. So he can do the chemical peel, yeah, microdermabrasions, yeah, and then intense pulse light and all that. So this is all the procedure that which is allowed under your chapter. You cannot do other than this. Yeah, you cannot do if you are the LCP chapter 1 holder, you cannot do the LCP chapter 2 procedure or chapter 3 procedure. But for you, if you are the LCP chapter 2 LCP holder, you can do the LCP 1 procedure. Okay, this is I think everyone must understand, because a lot of practice nowadays, yeah, by our colleagues in GP clinics, actually they are the chapter 1 SCP holder, but they do very, very invasive procedure at their clinics. And then it turns out that patients not satisfied with the outcome, and then turned out with a very bad outcome. For example, they land up with a very bad infections, and then supposed to be hidung yang mancung, tetapi menjadi hidung yang semakin buruk dan semakin membesar. It's not mancung anymore. So actually a lot of complaints, yeah, we receive a lot of complaints from those patients receive a treatment at this wrongly practiced GPs. So actions has been taken against them, and we have sent our enforcement team to that particular clinic, yeah, to investigate the case, and even we have taken serious actions against this bogus practitioner. Okay, I can consider that as bogus practitioner because you are not allowed to do certain procedure, especially semi-invasive or non-invasive, if you are not belong to that chapters, and then the place of practice which is not right. Okay, you do some very invasive procedure in your clinic and then end up with a very bad outcome, with a very bad infections. When some patient may die because of the allergic, because of the inappropriate anesthesia was given in the wrong place. Yeah, we have heard a case of GA being given at GP clinics, just for that procedure, and patient end up with a very bad outcome. So for those, for you all to practice in Malaysia, this is the one that actually you are looking for. I mean, you have to sit for the exams, you have to attend the course to make sure that at the end of everything, you get this LCP. Person in charge must have a valid LCP. If you are already a GP, if you want to practice aesthetic as an interest in your clinic, the person in charge, the doctor in charge must have valid LCP. Yeah? So aesthetic services provided limited to the procedure stated within the LCP of the practitioner, as what I mentioned earlier. But now this LCP will be signed by Datuk Asmayani lah. It's not Datuk Raizat. Because Datuk Raizat dah retire dah. Okay. Next. Okay. This will be my as I mentioned earlier, opening a clinic. How to register? Maybe some of you already have a clinic. Maybe some of you have some intention to open a clinic in the future. So next. Okay, under the topic of pendaftaran klinik swasta. Okay, next. Okay, oh, this is in bahasa. Okay, under this section 9 Akta 586, pengecualian daripada zoning bagi penubuhan klinik swasta atau klinik pergian swasta. What does it mean? It means for the opening of any clinic, either it is a dental clinic or it is a medical clinic, you are spared from zoning processes. It means that anyone can open medical or dental clinic in any area. You don't have to get any zoning clearance. That's why you can see that in certain area, especially in the commercial area, for example, in KL itself, you can see there is numbers of clinics in one area. There'll be maybe 10, 11, even 15 clinics in a small area. But in another area, we don't have even a single clinic. Private, I mean, it's private clinic, because we so far we don't impose this ACTA, this sections 9 under the Act of 586 for the zoning of medical clinics and dental clinics. Maknanya dia everyone can buka clinic in any area. Yeah, we don't need any zoning purpose. Okay, next. These are the procedure for you to register your clinics. Number one, you must have the permohonan pendaftaran klinik baru. So this must go through the MedPC online applications through our websites. And then you must print out all this information that you have filled in the MedPC online. So you have to bring the hard copy to a JKN wilayah or any JKN negeri that your clinic will be open. For example, if you are in Kota Baru, you have to bring your application form to Jabatan Kesihatan Negeri Kelantan. Maksudnya you have to bring the form to CCAPS Kelantan. If you are in Penang, you have to bring your form to CCAPS Penang. Selangor means you have to bring the form to CCAPS Selangor. Okay, once you have all these form, so at the end of it, you'll get your Borang B. It means your license to practice, your license to operate the clinics. Not license, mean the certificate of registration for you to operate the clinics. B for medical clinics, Borang C for dental clinics. Okay, next. Okay, here's some detailed process. Okay, first of all, the permohonan must be melalui MedPC. And then you have to fill up everything, fill in the forms in the MedPC. Then you have to print out, and then under the our website, a lot of garis panduan permohonan pendaftaran klinik is available. So all the checklist is available. So you go through, make sure that all the checklist, all the information, support documents needed must be make available to CCAP negeri. Okay, next. Okay, so once you have tender your borang to CCAP negeri along with the fee, which is you need to pay not that expensive, it's only 500 ringgit, for you the processing money. And then the CCAPS negeri will go through your floor plans, your support documents and everything. And then when they are satisfied with your floor plans, mereka akan keluarkan satu notifikasi surat tiada halangan terhadap pengubahsuaian klinik. So once you receive this surat notifikasi, it means that It means that you can start renovate your premise as per the approved floor plans. So once you have completed your renovations, you need to inform back the CCAPS Negeri. So these people, the officer from CCAPS Negeri will do the lawatan verifikasi, verification visit to your center to look in detail the renovation that has been made by you must be according to the floor plan, approved floor plans. Okay, next. So next. Okay, once your premise has been visited by our officer, and then they approve that your clinic follow whatever in your approved floor plan. So CCAPS Negeri, CCAP JKN Negeri will send your application to CCAP HQ. So CCAP HQ akan review all the applications once again, and then we will bring the matter to the Mesyuarat Jawatankuasa Penilaian Lesen dan Pendaftaran. So most of the time, this mesyuarat will be chaired by Deputy DG or myself. Yeah. So once we satisfied that everything is okay, your floor plan is okay, your measurements, everything is as per akta, you must comply to the akta. So permohonan yang lengkap akan diluluskan di Mesyuarat Jawatankuasa Penilaian Lesen dan Pendaftaran. Yeah. So once you have received this lampiran A from HQ, it means that your registrations, your clinic is almost done. Yeah. So the lampiran A just for you to semak, to make sure that all the information that we are going to print on your certificate of registration is correct, especially your names, your clinic's names, your IC number, and all other relevant information which is need to be printed on the certificate of registrations. Yeah. So once you have received this lampiran A, and then we receive back the lampiran A from you, so we will produce a certificate of registration for you with the fee. Okay, for you to get your COR, you must pay the final fee, which is only 1,000 ringgit. Means altogether for you to get your registration, certificate of registration, altogether you need to pay the fee of 1,500 ringgit. 500 with JKN Negeri, and then the last part 1,000 ringgit to the HQ, CCAP HQ at Ibu Pejabat KKM Putrajaya. Okay, next. Okay, once CCAP HQ receive your fee, which is the 1,000 ringgit, and then CCAP's HQ will print out your certificate of registrations, which is the borang B for klinik perubatan swasta and borang C for klinik pergigian. Okay, next. This is the formula. This is the borang. The borang B and borang C. Once you have received this, it means that your clinic is already a registered clinic. You can start your business. But for you to practice aesthetic in this place, in this premise, you must have your LCP, as I mentioned, as I shown earlier. Okay, next. Okay, this is our website. Medical practice. This is a new website for the medical practice. Okay, you can get all the relevant information if you want to register a clinic, if you want to get more information on the LCP, if you want to download the LCP guidelines. You can go to our website, and then you can get all this relevant information from our website. Almost done. Next slide. Thank you. Wah, 1 jam saja hari ni. Okay, now I open for any question. I think before you ask me a question, I think all of you have heard about the recent enforcement action has been taken on the beauticians, foreigners, which is actually these foreigners I can say some of them actually are doctors, but they come to Malaysia under the what we call that, a tourist visa, but they do aesthetic practice. Yeah, they do some operations, some chapter 3 activities procedure in Malaysia. So I think last couple of weeks, Jabatan Immigration Malaysia as well as the enforcement unit under the medical practice division has raided these clinics. I mean the beauty center with along with the enforcement officer from Jabatan Immigration, and many of them actually has been remanded by the Jabatan Immigrations. And of course, this clinic actually they have no LCP at all. Yeah, and then they do a lot of hanky-panky things, and then a lot of complaints against them. Yeah, so that's why we at the medical practice division, we want to safeguard you as well as the all patient in Malaysia, yeah, our people. So we need certain standard, certain minimum standard, certain minimum qualification that you must have before you can practice aesthetic medicine in Malaysia. Okay. If you have any questions, if you can type, you type. If you want to Rusty, if they want to ask me, I mean, they just can turn on their mic and can ask any questions. Is it okay?
Yes, Dr. Ken.
If you have any questions, you can ask me because I think we still have time. Or is there any questions in the chat box, Urustia?
No, doctor, there's no question. Still, there's no question. Dear doctor, do you have any question? Please type in your chat box.
Or you can just turn on your mic and can directly ask me.
Good morning, doctor. My name is Pujata. I just want to ask, let's say this clinic is registered under a qualified doctor who holds...
Sujata, I can't hear you.
Can you hear me now?
Okay, better.
Okay, let's say if this clinic is registered under a qualified doctor who has got LCP and say he's got a few branches and can a beautician, let's say he has employed some beautician and can the beautician perform things like laser on patients? Is that legal?
No, that is not legal. The beautician, they can employ a beautician to assist. It means that the doctor must be there. The doctor must do the procedure. The beauticians, the non-registered person, the non-trained person, assist the doctor. As what mentioned in section 9 under the MMC guideline.
Yeah, but there are a lot of practices like this is going on.
Yeah, I know. That's why I said, because we receive a lot of complaints on this issue. That's why our enforcement team look into this matter, and then that's why we have to work together with other agencies as well. For example, we have to work with Jabatan Immigration if it is involving the foreigners. We have to work together with the KPD and SGP. And because of the beauty center, all these registered under PBT, these are not clinics. They are not registered under the Act of 586. These premises registered under the pihak berkuasa tempatan, which is under KPD and SCP. Yeah, that's why a lot of arrangement has been made to work together with other agencies for the action.
Yeah, and they put a lot of advertisement on Facebook and so many other social media. So I think it will be very confusing for patients. They make it's legal and they go to this kind of beauticians for such treatments.
Yeah, I do agree with you. That's why recently one of the associations, has put up very wrongly advertisements using KKM's names, and it seems that the beauty center has got the endorsement by KKM. So actually this one, our actions, our penasihat undang-undang KKM, we already discussed with them. So some legal action will be taken against them lah, because they are wrongly used. It seems that their center being endorsed by the MOH, for example, yeah. So they use our guidelines, aesthetic guideline, as their own guidelines, but they are not RMP, they are not doctors, but they put their names as a doctor, you know, and then we check them. Actually, these people, yeah, they are doctor, but they are not a medical doctor. They are PhD doctor, PhD in business administration. Because they have PhD, they just put their name a doctor, and then this totally misleads our people. So our people think that these are real doctor, medical doctor. You see, that's why now we need to do more awareness about the aesthetic practices to all Malaysians. Yeah, because our Malaysian actually they prefer to go to the cheapest. Yeah, go to the cheapest to get their aesthetics done on their face. But at the end of the day, what they expect some beauty, tapi the other way around. Yeah. Okay. Hopefully that answer your questions. Yeah.
Yes, doctor. Thank you very much.
Okay. Okay.
Azman, there's a question in chat box.
Yeah, I'm looking it from Dr. Hi. Okay. Yes, doctor. From Sunzi. Hi, doctor. As we know, a dental officer does not have LCP. So how can a dentist practice aesthetic if they are interested? Yeah, dentist also can. A dentist also can apply for LCP. Also, we're going to have a very specific discussion on this, because for example, for orthodontics, yeah, they want to use braces. Okay, they want to practice. That one is part of treatment, can be part of aesthetic purposes. Yeah, some whitening, yeah, tooth whitening and all that. That will be under the aesthetic practices as well. But that one is not so critical as what when we do the semi-invasive or non-invasive, semi-invasive or invasive procedure. Yeah. So for the dental, we will bring this matter into the discussion whether if they really want to practice LCP. So we need to get the endorsement from the Malaysian Dental Council before we can impose on any LCP for the dentist to practice in Malaysia. Yeah, to practice aesthetic in Malaysia. Okay, next question is from Anati. Sekejap ya. Okay, if I want to open a clinic in the future, that clinic must be under klinik perubatan. Yes. Okay. There is no Medispa clinic, etc. No. So far, no Medispa. Medispa actually it's not a clinic, yeah. But for any doctors, if you want to practice aesthetic medical practice, you must practice this at these three places. Number one, clinic. Number two, ACC. Number three, at hospital. So it means that you must have a proper clinic, yeah, under the registered under the RMP. Okay. So no clinic term as Medispa under the Akta 586, yeah. So if that clinic also under apa tadi? Okay, if under klinik perubatan, meaning we have to offer medical services, primary care. Yeah. Okay, you still need to treat URTI, some abdominal pains, all that, if the patients come to you. If you want to focus only on the aesthetic, it is up to you. You can also practice. You can also give main focus on your aesthetic practices. It's okay, but because your name, your clinic name is a clinic blah blah blah, yeah, patient may come to you for URTI, for some other ailment. So you still need to treat them. This is part of your income as well. Okay. So 2 in 1. It is better rather than you just only practice aesthetic. Okay. Anati, is it okay? Okay, from N. Good morning, doctor. My name is N. I'm working as a GP now with a clinic having no LCP license. Wow, okay. However, if I am doing aesthetic attachment with a clinic with LCP license, okay, there will be mana ni? Sekejap, there will be problem with my LCP application. No. You can still apply for your LCP. It's okay, no problem. You have no problem. You can apply. Okay, and then later on, if you want to open a clinic, you can use your LCP for you to practice your aesthetic medicine. Okay. From Jasmine, what is the guideline for to internal med physician to get LCP? Okay, for Dr. Jasmine, you can download the guideline as I mentioned just on the pink color. You can go through that guideline. There'll be a specifically mentioned in that guideline for medicine. Internal medicine specialist, yeah, to apply for LCP. You once you get through everything, you will be granted chapter 2 LCP. It means the procedure which is you can go and do some minimally invasive procedure under the chapter 2 LCP. Yeah. Okay. Okay, Dr. N. The guidelines say 2 years of relevant training in aesthetic medical practice under supervision or attachment. Is there a more specific requirement, like how many hours? Yeah. Okay, if you go to the guideline, I'll get you some detailed information here. Okay, for example here, if you, hold on. Okay. Okay, for example, for chapter 1, which is for general practitioner, for you to do non-invasive procedure, for example, chemical peeling, requisite number of procedure performed minimum 20, micro dermabrasions also 20, for intense pulse light IPL also 20. Yeah. For minimally invasive for chapter 1, contoh kat sini is a chemical peel, minimum depth. You must perform at least 25. Botulinum toxin or Botox, at least you must perform 25 procedure before you can apply for LCP. Yeah, filler injection 25. Okay, for the chapter 2, this is certain okay, for chapter 2. Chapter 2 minimum requirement, okay. Okay, for chapter 2, for example, here is we go for the minimally invasive laser for treating skin pigmentations. Requisite number of procedure performed for the non-core specialist at least 20 in numbers. So okay. So bermakna dekat sini okay, bermakna dekat sini if you want to apply, you must at least perform minimum of 20 lah for certain procedure 25 procedure before you can apply for your LCP. It means that you must complete your logbook. Yeah. Okay. Within that 2 years. Okay. From Sujata, is there a shilling price for each aesthetic procedure done in GP set up for doctors to follow? Okay, so far aesthetic we don't set shillings yet. Under the Schedule 7, aesthetic charges still not regulated. Okay, still not regulated. Okay. From Hanisha Rahman, what are the example of ACC? Okay, ACC ni ada banyak. Sorry, this is my first time hearing about ACC. Is ambulatory care center. And for example, we have ACC just for ophthalmology services. Yeah. So under that ACC, they have their ophthalmology clinics. They have ophthalm OT, for cataract operations. So we have ACC just for radiology services, with CT scan, ultrasound. Kita ada ACC yang ada cardiology services. For example, they have echo, they have angiogram, yeah, and then they have a stress test activities. Okay, actually this is my ACC means you do more procedure compared to GP clinics. Okay, alright. Okay, and then from Sharifah, how many clinics can one LCP holder has? Let's say the LCP holder has 2 clinics, but only works in a clinic A, then another LCP holder. Okay, as per standard, any GPs, you can have at least, you can have minimum 3. Yeah, you can use your name maximum 3, maximum 3 clinics can be registered under your name. But the most important is the time of practice. Probably if you have a clinic, 3 clinics, mean morning you have to practice at clinic A. After that hours, you must close that clinic, you go and practice at clinic B from 2 to 6 p.m. and night you practice at clinic C from 8 to 12 midnight, for example. Yeah, there is a maximum numbers of PIC that any doctors can hold. But some doctors, they try to have few PIC, name themselves at few clinics, but they hire locum. This is actually we should not allow this. And if during our visits or this come to know to our enforcement team, we'll take actions against doctors. But for LCP, since you need to practice, but so far we only allow LCP holder to practice at only 1 clinic. Okay, let's say the LCP holder has 2 clinics but only work in a clinic A. Can another LCP holder medical run a clinic B alone? Okay, it means that you have 2 clinics. Okay, 2 clinics but work in 1 clinic A, and can another, of course, if they have if the second doctor has the LCP, and then that clinic must be registered under his name under the second holder LCP then only you can allow to practice. Then only we can allow that doctor practice aesthetic activity at clinic B. Yeah. Okay. Clear doktor siapa tanya tadi tu? Dr. Sharifah Okay.
Sorry doktor, kiranya kan if
apa ni?
Sorry, saya Sharifah yang tanya soalan tadi. Kiranya if in the second clinic, the non-LCP holder, kalau tak ada LCP, meaning cannot practice alone lah kan in that clinic. In the other clinic.
Can another non-LCP holder, tak boleh. Kalau non-LCP holder, dia tak boleh practice aesthetic at that clinic.
Okay,
tak boleh.
Alright.
Tak boleh. Mana dia those that's why I said LCP ni is not only to to make you to make that clinic can practice aesthetic, but the most important is to make sure that those are practicing aesthetic ni tahu they are well trained, they are know their limitations, So tapi kalau katakanlah dia ni tidak ada LCP holder and then try to do aesthetic, we fear lah, because probably they are not well trained, they do not know their limitations and all that. Itu akan menyebabkan patient safety akan tergugat lah sebenarnya. So that's why those non-LCP holder cannot practice aesthetic medicine in any GP clinic. Yeah. Okay, Sharifah?
Yeah. Doctor, sorry, can I add another question then? Meaning to fill in our logbook, then we need to do the procedure
Under supervision.
under supervision of an LCP.
Yeah,
Okay,
direct supervision.
Okay, understand.
Okay. Macam masa houseman lah, macam masa houseman kan, you must have your senior medical officer to observe you doing a procedure. Then only they can sign your logbook, right?
Yeah, correct.
Okay, alright.
Thank you, Doctor.
Okay. From Dr. Lim, is it possible to get a locum doctor who has LCP to practice when the PIC is not available? Okay, this is allowable. Yeah, this is allowable. Okay, Dr. Lim, this is allowable. Because our LCP, if you see, tapi are you there enough to take another doctor to do a locum at your clinic and then do this kind of practices? Because you must remember that accountability is still on you. If anything happen to the patients, the bad outcome and all that, you must take the responsibility and accountability on that matter. Okay, and then to me, to safeguard you, better not to allow other doctors or other persons to do aesthetic in your clinic. Because the skills and satisfactions of our patients varies. And then if the patient's not satisfied with the outcome, so I think probably you are in trouble to explain to them, to get back other people to do some corrective measure on the patients. Okay. There are a lot of backlogs application for LCP exams. Okay. This plan to speed up the process. Okay. Because the backlog, because of the of COVID, because of the LCP, because of even our staff, our aesthetic section staff being mobilized to manage COVID patients during the peak hours, during the peak time at my aims and all that. But now it seems that everything is almost normalized. We are towards the endemic. So now even we have started our LCP exam last month. We started it back. So hopefully we can start smoothly. That we know that a lot of applications being put into hold because of these COVID issues lah. So hopefully now onwards, we can speed up our process, and then don't worry about that, Dr. Lim. Okay, any other questions? Kalau tak ada, saya serah balik kepada MC.
Thank you, Dr. Azman. Thank you, Dr. Azman, for a very informative lecture. I hope the rest of the doctors have a good session with Dr. Muhammad Azman. Thank you, Doctor.
Okay, if anything, you can email or can call to my office. I think I put my numbers at the end of the slide, kan? So,
yes, Doctor.
Uruste will share the slide with everyone.
Yes, Doctor, I will share that with everyone.
Okay, I'll send you the soft copy of the guideline as well. You can share with them as well.
Yes, Doctor. Thank you, Doctor.
The MMC as well as the medical practice division guideline, you can share with them as well. So easy for them to refer to these two guidelines.
Sure, Doctor. Thank you, Doctor.
Okay, all right. Okay, good luck.